organization called DeLorean AI, and their process that they're using in preventive medicine that is using AI to scan medical records to sort of predict when someone is going to have renal disease, diabetes, cardiovascular disease, behavioral health, or respiratory disease issues, and then kind of alerting their doctors to say, hey, you may want to check them for this. And joining me now, the man behind it, Severence MacLauglin. Thank you for making time for me today.
Hey, Mandy, thank you so much for the opportunity. Really excited to talk about my favorite subject, AI and healthcare, and continuing that conversation with the public. So thank you so much.
I want to ask you, why DeLorean AI? Is there a Back to the Future connection here? Is there a sports car from the 80s here? What are we doing?
You better believe it, Mandy. So in 2019, when we founded the company, I was sitting in my living room or kitchen, and I was with my partner, and I was like, what are we going to name this? And I'm a huge 80s fan. So I was thinking weird science reference, or it was going to be maybe something with Ghostbusters. And then it just popped in, right? Back to the Future. Like the DeLorean goes to the future, takes the information, and comes back. And here we are. We're DeLorean AI.
I love it. I absolutely. You just made me so happy by confirming what I thought to be true. So thank you for that. Tell me about how this predictive AI works and what you guys have already seen, because this is not untested. This is proving itself on a regular basis. But what does this AI do?
Yes, ma'am. So our flagship product is what we call medical AI, and it's in a number of disease states. So we're fully proven out in kidney, so renal, so chronic kidney disease and dialysis, cardiovascular disease, so blood pressure, heart attacks, COPD, so breathing challenges, mental health. And then what the tech actually does is, as soon as we turn it on, it gives a real-time risk to the doctors as they are right now. And then that changes by minute or by day, depending if you get a prescription or you had a blood pressure reading read. The second thing it does is it predicts in the future, will you get better? Will you get worse? Or will you have an adverse event such as a heart attack or a hospitalization? And then the third thing the model does is, our secret sauce is, what do you do with that information? What does the doctor do? What does the nurse do? What do you do? And we call that next best action. So that could be a change in your medication. That could be a change in the titration. That could be, we're predicting that a heart attack, so we need to get you a baby aspirin, or maybe an appointment with a cardiologist because the heart attack's 2 weeks away. And then we also find, Mandy, unknown people with a disease state which is unknown to them. So what that means is 40% of the population that has chronic kidney disease don't know they have it until they're going to a kidney doctor. So we can find those people 2 to 3 years beforehand.
Oh, wow.
And be able to get them on medication or treatment. Yeah, and it extends their lives 5 to 20 years, theoretically. So more hugs with your grandmother, more time with your loved ones is how we measure success in that way.
Can you also keep people off dialysis? Because I have a friend who didn't know he had kidney disease until it was stage 4, and there's nothing they can do at that point. There's no medical intervention other than you're going on dialysis, and we'll hope for a kidney transplant.
So what you're outlining is correct, Manny. And what we do is we can delay that or retard that process as much as we can. And we have seen patients do that. But once you get into dialysis, then we have a really good track record of preventing hospitalizations. And so one of our clients that has 250 clinics in the United States, we've decreased hospitalizations by 26%
Holy cow.
within 3 weeks of those dialysis patients. So if you go to the hospital, you have a higher rate of bad things.
Well, yeah. I mean, everybody dies in the hospital.
Yeah.
Let me ask you this. Give me a layman's explanation of how this AI actually works in the background. What is actually happening to gather all this data? How is that all pulled together?
Yep. So our clients are usually large doctor offices or insurance companies, and they have all the relevant data, but they don't understand how to mathematically put it together. So DeLorean, if you will, she basically searches that, brings it all together, and mathematically says, okay, we know that your kidney disease normally looks like this from diagnosis to the end. And what she looks at is how far away are you from the ideal? And those changes, she can make predictions based on those changes of those profiles. So, and then that gives the timing and that gives the change needed in the treatment for people to get better or preventative. Does that make sense?
Yeah, it does. I mean, have you been able to demonstrate that you are preventing heart attacks? Obviously, you're dialed in on the renal disease part, but
Right.
where are we on the other, like cardiovascular disease?
Yeah, so renal we're so we're the first AI in the world to be biologically validated, and what that means is that our predictions and forecasts have been proven to be true and accurate by 3 independent organizations, one of them being a Fortune 5. And what they did is when we predicted something, they tracked the lab results, the bloods, the hospital records, the hospitalizations, the infection rates, and they said, "Yep, you guys are 95 to 99% accurate."
That's
so
amazing.
renal we're really good at. So for heart attacks, out of 8 million, we had an 8 million population there. We were 88.5% accurate in catching the heart attack within 3 weeks.
That is incredible. I mean, in terms of just getting interventions before people end up dying. I mean, that's really incredible what you're doing here.
Yes. It's we are blessed. We're on a mission, right? And like we're improving lives and extending those hugs. And from your viewership, Mandy, the way I look at this is, my mom and dad had their own business. They work really hard for their health insurance. Is when you buy your health insurance, you want to make sure your health insurance and your doctor is using the AI, because no one human being can do what the machine can do. It allows these doctors and nurses to practice at the top of their license and do the best work that they can do.
I think the other interesting thing that's happening is in the diagnostic tech that is coming out, the diagnostic AI that's been shown to be, a little more accurate than a human doctor, because when you put everything in, you put all the symptoms in. So yours is just on the other end of this. Like, we've already gone to the doctor, we've already gotten a prescription, we've already found out our blood pressure was a little bit high or whatever. And then you're just crunching all those numbers to say what's going to happen next.
Yeah, and 2 things, like one, in real time, which doesn't happen now normally. And then number 2 is predicting with all the information what will happen in the future, right? So will there be a development of kidney disease? Will their diabetics go from diabetes into kidney disease? Or, something with mental health, and our accuracy is a little bit lower there because it's a more subjective nature, is when we're talking to psychiatrists, the titration of the medication, getting that medication right, is often the longest process to helping someone heal or get better. And we're able to get that done objectively, within seconds versus like 3 or 4 months of trying out different levels of medication.
That's amazing. The company is DeLorean AI. Are you guys publicly traded? I'd buy stock in this.
No, we are currently privately held and continue growing, but hopefully we'll get there. But we're blessed in the ability to help people, and we hope to continue to do so.
I got one question before we go. We're almost out of time. This question from our text line. Please ask how they clean up the flawed data in medical records. So I don't know the follow-up on that, but...
Well, that is a great question from your listeners. So, and I get excited about this because, humans sometimes enter the data and it's messy or dirty or whatnot. I never say dirty data or messy data is bad, right? So we actually had to design another AI to auto process that and to make sure values were within the right thing. So you don't have a blood pressure of 2,000 or there's a missing blood pressure. So we've actually had to automate all of that. And the other part, Mandy, is we had to invent security measures because the AI was so new that there was no security to protect it and the PHI and things of that nature. So we've actually had to build a lot of AI around the medical AI to make it work.
I love this. Severence MacLauglin, what a great idea. I love the fact that it's called DeLorean and that you call her she. That makes me very happy. So there you go. I hope we can, I'm going to keep watching DeLorean AI and hopefully you guys are going to continue to grow and help people stay healthy.
Well, Mandy, thank you so much for your time. And if we can ever be of help to you and AI, we'd love to be there for you.
All right. Thank you so much. That is Severence MacLauglin with DeLorean AI.